Well, we're really delighted to be here at the ICWMDS 2025 meeting, and we just had a wonderful session talking about classification, prognostication, eligibility criteria in MDS, CHIP, and CCUS. And I have a wonderful panel of discussants, and I'll let them introduce themselves.
I'm Robert, a surgeon. I'm a hematopathologist, and I work at Mass General Hospital in Boston, Massachusetts.
My name is Zoe Shi. I'm from Moffitt. I work for myeloid diseases, particularly focused on CHIP and CCUS.
Hello, my name is Luca Lanino. I'm a hematologist, now serving as a postdoc at Yale University in New Haven, Connecticut.
And I'm Dr. Uma Borade. I work at The Ohio State, and I take care of patients with MDS, early precursor disease, and AML. So I'd like to start the discussion just maybe starting with Dr. Hasarjan, and you had a wonderful talk about sort of you highlighted the difference between sort of prognostication, classification, and then you really brought home the changes that have occurred so far and where you see the field is going. So I know you had a 10-minute talk, but maybe you can compress that in 30 seconds and kind of give us your view on that.
Yeah, sure. So I'm a hematopathologist, and I focus on disease classification. And in MDS, the idea of this was to develop different disease groups of patients that had different features, which initially was the way things looked to us pathologists under the microscope. But as we've increasingly learned about the genetics of disease, we realize that many aspects of disease are driven by the sort of aspects of the disease that are sort of stitched into the genome. That is the profile of genetic aberrations and cytogenetic features. And these are now beginning to enter our classifications, defining specific groups. These can inform therapy because they can indicate vulnerabilities based on the particular genetic aspects that can be targeted, which includes some new drugs that have recently been approved. But I think only about a third or a quarter of MDS cases now fall into genetic groups. So I think some new current AI and machine learning informed classifications have emerged that propose classifying all cases in terms of their genetics. I think these need further validation, but I think they're exciting because they can introduce a more objective way of classifying the disease and potentially identifying new genetic targets that may have, in the end, help to benefit patients. And again, I think that moves beyond just risk stratification because it indicates specific disease categories that could help decide what therapies for the clinicians to give the patients.
Wonderful. I'll kick it over to Dr. Lanino on your efforts in sort of harmonizing what has turned out to be a little bit of a tumultuous world in the last few years in MDS and how to harmonize
very much
that.
So. Yeah, thank you. So well, what we did after the 2022 classification came out as a consortium, as a community for the ICMDS, was trying to harmonize, so find some common ground from the two classification. We applied some of the techniques that Dr. Hasarjan just talked about, and we were able to both, validate those new genetic entities that were defined in the 22 classification, and also highlight how much work needs to be done, referring to what he was saying just a couple moments ago. I do think that, these newer tools, AI, machine learning, can help us together with, all the lab work, all the bench work. And as we need to find new entities, because what we're lacking right now, that's pretty obvious, as also came up in the discussion, we don't need drugs that work very much.
Mm-hmm. And so maybe to sort of end your discussion, you ended your talk by talking about a sort of a very aspirational vision of what you want this to look like. And, you're a young rising star, and maybe when we retire, that vision will come true, or maybe before that. So maybe describe kind of what that aspirational vision.
Yeah, the title of my talk was like a roadmap to harmonized classification in the future. I'm not sure I can devise a roadmap, but I have some suggestion, and I think we now have technology to amass vast amount of data, EHR pretty much everywhere. We have AI models can help us extract information from those without manually annotating all of that. We can put all of those together, and hopefully we can extract information to define these new entities. And another thing that I think is very important is that those results should not come out only as papers. Those should be platforms that anybody in the community can interrogate, can investigate, and hopefully can generate new hypotheses.
I think that's great, and that's so critical for our field. So I'm going to switch gears a little bit and talk to Dr. Shi, who I think did a fantastic job of outlining the challenges of going a little bit earlier, right? Our earlier stages to MDS, which is CCUS and CHIP, and we're all interested, hopefully, in intervening a little bit earlier when patients aren't as sick, but we are struggling in how to do that. And I think your talk really summarized the challenges, but also the opportunities of how to do it. So maybe if you can give a little bit of an overview of what you talked about.
Yeah, so in my talk, I first gave an overview of the current and ongoing clinical trials. We can see over the past 8 years that we see a steady rise of the clinical trial activities. However, we find there's a lot of heterogeneities across these trials, including the inclusion criteria, endpoint selections, and the biomarker integrations, and even for the primary endpoint assessment timing is really all over the map. So these are really cause a lot of challenging to interpret the results across the trials. And our goal is really to bring the results to our patients in our practice. And given these challenges, make it so hard to do. So so at the end of the session, I provide a kind of try to share a proposed framework and how we can do this better and to standardize this CHIP and CCAS clinical trial design from the both investigator perspective and also from the FDA perspective, and how do we match each other to meet their standard. And eventually I hope that we have some therapy and bring it to our patients.
It's great. Yeah. So maybe we can end this by each of you sharing some thoughts, like specifically for patients. Maybe a patient who's looking up MDS, has just been diagnosed, is looking up things online, they see this video. Maybe what you can share, just one or two things that you would like a patient with these diseases to know about kind of what your efforts are and where you feel the field is going. So very patient-centered kind of comment, maybe.
Sure, I can start. I think patients should be aware of the disease they have. They have MDS, but also a specific subtype, and I think that could be a genetic subtype. And then I think patients are often following things like the blast count, and that could be a measure of effectiveness of therapies, something additionally applied. So I think patients obviously should also know their risk assessment, the prognosis, but also the specific type of disease they have, because that may help them understand why particular therapies are being given to them.
Great.
And Uma, I really love your question is, patient-centered. I think at Moffitt, I want to bring out, so we have a CHIP clinic similar as you have and other centers have. So this is, I recommend patients who had this condition like a CHIP or CCAS, this patient will be referred to an academic center, have a really comprehensive discussion. What does it mean? What are the implications? And then we as an investigator trying so hard to bring the trial to our patients. So the trials are coming and, hopefully we can, like I said, eventually we can bring this therapy to our patients.
Wonderful.
And one page to know, MDS is a rare disease. Numbers are low. It's difficult to have progress in the field, but there is a vibrant, active community. ICMDS is one part of this. There's a lot of others. And this community is really moving forward with new advancement. And so there is hope for everybody with a diagnosis of MDS.
Well, I'll end by adding my 2 cents. My talk specifically in this session was really around making sure that we can get more and more MDS patients access to clinical trials. And as a community, as we mentioned here, all of us at this meeting, we're really focused in the end on patients because we want to get newer treatments to patients. And I think all of these efforts are really geared towards that. So just know that there's a lot of us working to hopefully solve the problem of MDS and make your lives better. So with that, I want to thank everybody for being part of this, and thank you.